try that. Cool. Okay. So as Hannah introduced, I'm Skylar. I'm present and a guest on the Silks Okanagan territory in Kelowna. I feel very privileged to live here, and it's cool. Hannah and I work in a building across from each other, so it's cool to connect with her, and I'm really excited to speak with you guys. There's a few familiar names. I did my degree in Prince George, so good to see my PG girlies and Robin. I think that's the Robin I know. Welcome. I want to talk today about pushing and pooping. As you guys know, that's why you showed up, right? Especially you 38 weekers, you're like, okay, I'm going to be pushing soon, right? So let's figure out how to do it. It's going to be pretty honest, hopefully a practical session. I'm going to get down on the ground. I've got my ball back there. And if you don't have a ball, I highly recommend getting a ball, even if you know your hospital has a ball, because they'll just be good for you to practice so you feel familiar with these movements prior to getting to the hospital. Because sometimes you get to the hospital and you're like, okay, and now what do I do with this ball? Like, how do I move my body? But I think Hannah also goes through some really great poses that can translate to using a ball. Um, it's going to be awesome that you got the prenatal yoga class after. Hannah was showing me some of her setup, and I'm like, okay, I think she's probably going to touch on some of the moves I'm doing, so it's perfect. So when you were pregnant, obviously your body changes a lot. A lot of the culprit of aches and pains and dysfunction can be the pelvic floor. It's not necessarily that the pelvic floor is a problem. It just maybe isn't like prepped appropriately for this growing baby inside of you. So if you're having SI joint pain, so for example, like right here, this is your sacrum and your ilium bones, and the joint right here is your SI joint. So if you have that low back pain, that could be caused by like pregnancy itself, but also your pelvic floor. It also challenges muscles, so the pelvic floor itself, and then majorly our central nervous system. So being able to relax your central nervous system using tools like yoga and breathing is really critical, especially when you're in a situation where you're in pain, which birth can frequently be a painful experience. But I often say to my patients that really like the only thing that you can control when you are in while you're in labor is how you respond. So if you have those tools going in with your breath and tools that you know help calm your nervous system, you're going in stronger than someone who might not know how to tolerate a really intense situation. Um, and during birth and during labor, being able to be mobile and your body positioning really impacts how baby moves out of you and how you experience pain. So, trying to maintain mobility through your labor is really important. And with that being said, a lot of people have this misconception that your pelvic floor pushes your baby out. So, if we look at your pelvic floor, here's your sit bones, tailbone, pubic bone. Okay. So it's like a bowl, right? In case you've never seen this visual. And in order for a baby to come out, if you right now are sitting here and you try to stop your pee, okay, so everyone try that, try and stop your pee. What's happening is you're pulling your pelvic floor up, okay? It's contracting your pelvic floor, it's shortening your pelvic floor. And what that does is it makes the outlets, like your vaginal canal, tighter. It makes it smaller. So baby is not going to come out if you have a strong, tight pelvic floor in that moment. We want our pelvic floor to relax, and really like the pelvic floor's role in birth is just getting out of the way. So being able to relax during birth and during labor is really, really important for the pelvic floor. The better we can do that, the better outcomes in terms of limiting tearing, limiting any trauma around the vagina. So this isn't to scare you guys. It's just to be honest. Like I said, I'm going to be honest and practical here. Tearing does happen, and us saying we can prevent it is a challenge. We're doing our best to make it less likely, but it doesn't mean it might not happen, right? We don't know what's going to happen in the situation. And the only thing that you can control is how you respond, right? So, areas that you may get trauma, this is your perineum. So, your rectum, your vagina. So perineum here can sometimes have tearing. So the degrees of your tear depend how far the tear is gone. But on top of that, there can actually be tearing around your urethra as well. So it's not just down. It depends on how baby's coming out. It depends on your positioning. And that's why it's important to be aware of your positioning. And again, that wasn't to scare you. It's just to be realistic because we all know someone who has given birth and had stitches after because they had a little bit of a tear. Okay. Okay. Before I move on, does anyone have any like structural pelvic floor questions? If anyone feels confident enough or that they wanna ask, maybe like 2 seconds. Okay, I'm gonna say no because no one's unmuting. Okay.
And you guys can put the questions in the chat too.
Yeah, I'll monitor the chat for sure. Okay. Um, Actually, I'll go through the function of the pelvic floor really quick. Pee, poo, sex, baby, and sump pump. Those are really what our pelvic floor is doing. We relax to let baby out. We contract to keep pee and poo in. We relax to let pee and poo out. And then we move with our diaphragm to help kind of pump some of the fluid from our legs up to our upper body. Those are the main function of the pelvic floor. And of course, today we're focusing a lot on the relaxation to let baby out and then also the relaxation to let poop out. When we're thinking about pushing, if you've done your Google of like, how do you push? What is pushing? Two things tend to come up. The first thing is coached pushing, and the second thing is maternal pushing or instinctual pushing. I'm going to cover both. There's a time and place for both kinds of pushing. And if anyone has questions again about that, just let me know. So, maternal pushing is a spontaneous and instinctual sensation and urge to push. So, once you are fully dilated, which is your 10 centimeters, it may happen immediately and it may not. And you will feel like you have this urge to push. So, if you've ever been sitting on the toilet and you're like, you're going pee, and then all of a sudden you're like, I need to go poo and I need to push it out. That feeling, it's obviously a bit different when it's a full blown baby coming out of your uterus, but that feeling of the urge, the need to do something in that moment, that is when you would maternally push. So you will feel, I have to push right now, and then you would push. So your uterus is contracting, right? Your uterus is what's actually doing the work of getting baby out. And when your uterus contracts and baby finally starts hitting the very rims of the cervix, we get a reflex called the Ferguson or the fetal ejection reflex. And this is that I'm going to push. I need to push. So if you've watched videos of births, oftentimes women, if they're given the opportunity to do maternal pushing, they're like, I'm going to push. I'm going to push. Good, right? You're listening to your body. And like I said, not everyone can do maternal pushing the whole way through if you get an epidural, which I'll talk about as well. But so maternal pushing is spontaneous, it's instinctual, right? That's the main things to think about. And then when we think about coached pushing is when you are pushing as soon as you hit 10 centimeters. It depends what setting you're in. So you might be in a setting where you're just with your midwife or doula, and they may not be cueing you this way. They may really be advocating for maternal pushing, but you may be in a setting where that's not happening. And that's okay, but you should also advocate for yourself. And I'll touch more on that in a bit. But if you want to be doing maternal pushing, you have the right to do maternal pushing. If you are being coached to push and you do not feel the urge to push, you do not have to push, right? Like you are in charge of your own body. So if you do not feel like you want to push, you don't have to. Unless something is going wrong. Sometimes coach pushing and purple pushing, which I'll explain in a sec, is necessary. Say baby's heart rate is dropping and you need to get baby out, and the people who are in the room with you are coaching you to push. Then you do want to push because something might happen that would not be favorable for you or baby, right? So the two differences are maternal is instinctual, you feel the urge, whereas coached is you've hit 10 centimeters and you push, it's a 10-second push sort of thing, and you may not feel that urge. Okay, and those are the two biggest things. The way you push during those times matter. So purple pushing is generally how they're going to coach you to push. Purple pushing is if your face turns purple. It may not actually turn purple, but like if you were holding it long enough, your face would turn purple. So A purple pushing is a deep breath in. They're going to cue you to have a big expansion of your ribs, and then you're going to push, right? You're holding your breath. They usually, like I said, cue for 10 seconds. That's a long push. You're not breathing. It's depleting energy very, very quickly. You're losing oxygen, and it leads to higher risk for your perinatal trauma. Okay, and more pressure on your pelvic floor in general. So that's like a straining if you were pooping, right? So we want to use purple pushing when we need to, but if we can use open glottis, which I'll explain, then that's going to be more favorable for preventing tears, preventing pelvic floor trauma, potentially less risk of prolapse, and just better outcomes overall. So opposite of purple pushing is open glottis pushing. Glottis is a little flap at the back of your throat. When you breathe out in yoga, for example, and you're going, right? That's like an open glottis sound, and you can make that sound while you are pushing. So you can all try this right now. We're going to try a open glottis and a purple push. If you can, you may not be able to, depends how big your belly is, but you can put your hand under your perineum. Okay, so you're going to put your hand here. So I'm going to sit on my hand. Okay, and what I want you to do is we're going to do the purple push first. Okay, you got to have enough force that when the pelvic floor expands, you feel it. So you're taking a breath in, push out. Do you feel movement in your pelvic floor? If you don't, it may mean that you're not directing force down, and then we would really not be getting the most out of our purple push, okay, when we do want a purple push. So we'll try it again in case you didn't get it. You're taking a breath in, big rib expansion, and then bear down. Okay, that's that purple push. You might feel your perineum lower a little bit. Okay, it's probably going to be more forceful than when we right now try our open glottis push. Okay, so you can either, like, I will cue people to moo, literally like a cow, or you can go aha, or you can be like silent but still like a soft sound. I'm gonna moo because I'm shameless. I don't care. So hand is underneath your perineum. You're gonna take a deep breath in, and as you exhale, you're going to moo, right? Like that was, if you're laughing, it's okay, right? Like you want to push down, doing something forceful and let out that energy and that sound. That's going to help with your open glottis push. Okay. Hopefully, you felt both times that when your hand was on your perineum, there was a little lower or there was a little pressure. And what that is it's like your pelvic floor relaxing. It's giving it that opportunity to open, right? And down, because baby's got to come down, right? So, those are the two main things I want you to think of when you are pushing is open glottis or purple pushing. Purple pushing, we only use it when we need to. Baby's heart rate's dropping. Your doctor says you need to get baby out now, whatever it is, that would be when you would purple push. And then the open glottis is you're going to feel more inclined to do it when you're doing maternal pushing. Okay. So what if you have an epidural? It depends on your epidural. Okay. If you have an epidural, some people have walking epidurals. Some people are walking around, they're feeling great. They can feel their legs, but their contractions are less intense. They just feel pressure. Some people can't feel anything and you're like stuck on the bed. Okay. It completely depends on the person, depends on your anesthesiologist and your situation. So depending on your epidural will depend how much you feel that natural instinct to push. If you feel the instinct, follow it. If you don't feel the instinct, what you can do is you can have the people in the room who are helping you birth, you can have them kind of monitor your contractions and try to time your pushes with the contractions versus just once you've hit that 10 centimeters dilated. That would be like a true coach pushing. If you know that you're not contracting at that time, it may not be worth it because you're not really helping the uterus, right? The uterus is doing the pushing of the baby out. And when we push, what's happening is we're increasing our intra-abdominal pressure, the pressure inside our abdomen, to then bear baby down, right? So we want to be able to use the contractions to our advantage versus just, okay, we have an epidural, can't feel it, we're just pushing whenever they say to. Do so if it says so on the monitor that you're having a contraction. That'd be a great thing. So it all depends kind of on your awareness and how much sensation you have, what your mobility is. And that being said, too, position matters. If you have an epidural, it may be beneficial for you to use a peanut ball, like one of the, well, bigger than this, but the two balls that have like a little divot, have that in between your knees, lay on your side, or being in a supported upright position or something. I'm going to show you in a bit how your partner might be able to support your leg as well in a side lying, because side lying and upright positions or using gravity is generally a better outcome for pushing baby out. In terms of pooping while you're in labor, I'm just going to touch on this really quick, but like we all know, our butthole's right there and our vagina's right here. When baby comes out, it's going to be pushing on our rectum, right? So if there's stool in here, it's going to push it out. It's normal. It's going to happen. And in fact, if that's happening, it probably means you're using the right muscles because they're the same muscles we use to poop, unless you're straining while you're pooping. Okay. So normalize it and expect it so that when you experience it, it's just another part of the labor and you're not trying to hold it in. Because what happens when you hold it in is that, again, when I said like, okay, squeeze like you're trying to stop your pee, that's tightening everything up. That's making everything smaller. So it's actually going to slow down the process of giving birth and it's going to be more detrimental to the pelvic floor than help. And so my biggest piece of advice is literally just expect it. Expect that. And maybe it doesn't happen. That'd be awesome if it doesn't happen. But if it does, they're going to catch the poop, put it away. And it's going to be uh, a non-conversation. Like no one's going to care. Okay. A lot of people worry about it, but it is so normal and it is so okay that if you, again, if you're expecting it and you normalize it, it won't become a problem. It becomes a problem if you are not comfortable with that and you start trying to hold it in because it's pretty tough to squeeze your butthole but relax your vagina. It's pretty tough to do that. Okay. So if you want baby out, don't hold your poop in. Other things to do with pooping while you're pregnant now is you want to try to focus on regular diet and regular poops. So that's like max once every 3 days. Like that would be the longest I would say is acceptable. And then we're looking at, okay, we got to increase your fiber maybe. You got to hydrate more, or maybe we're going to become more active to try to get things moving a bit better. But trying to maintain a regular bowel movement schedule is really important because if you aren't and you are constipated, you may be straining and that puts more pressure on your pelvic floor, which is already working to hold up your baby, right? Using a squatty potty. If you do not use a squatty potty, everyone should be using a squatty potty, okay? When we look at our rectum, this angle here, it's called your anorectal angle. It's like pretty sharp angle, like almost 90 degrees. And I don't know if this will show in the video. You can kind of see that the fibers of the pelvic floor run in like a U, okay? And that's the rectum hole. So it's almost as if our pelvic floor is kinking around the rectum. Okay, so when you sit with a squatty potty, no, I have something here. When you sit with your feet up, this is like an extremely exaggerated squatty potty. But what happens is your pelvis tilts, and then instead of here, the angle straightens out. So poop comes out way easier when we use a squatty potty. And it gives an opportunity for more pelvic floor muscles that are kinking the rectum to chillax and let poop out. So even if you are or aren't, sorry, constipated, I highly recommend using a squatty potty. It will also hopefully prevent hemorrhoids or worsening of hemorrhoids because you're not straining as much. And then the other thing, when you're pooping, practice your pushing. That is an amazing time to practice pushing. Like I said, when you poop, you're using very similar muscles as when you are giving birth. So if you are sitting down, every time you take a breath in, imagine your pelvic floor letting go and relaxing. And then as you breathe out, keep your glottis open, make a sound, and try to let that would be when you maybe push your poop out, right? I don't want you straining to a point where you're like pushing and pushing, purple pushing and pooping. That's no bueno. But if you can practice the open glottis pushing on the toilet, that's a great opportunity to see one, what it feels like to get urged when you need to poop, what it feels like to feel like I gotta push this right now, right? And then also just practicing using the proper muscles. And then postpartum, first poop, first few poops. You may be in the hospital, you may not be, you might be home already. So a few different things, still using squatty potty. Again, if you feel like you need to poop, don't hold it. We don't want to be tightening and really aggravating the pelvic floor at this time. Just let it go. Just do your poop. Sometimes if there's stitches or if there's been quite a bit of trauma to the perineum, splinting your perineum can be nice. So taking like I don't have something here right now, but like a towel or like a compress or something and splinting it on your perineum here while you're pooping can help with some of the pain because as poop comes out, it could be uncomfortable if it puts pressure where you've just got stitches, right? Especially if you've had a really big tear that's torn into your rectum, that can be really uncomfortable. So splinting can be really nice to help mitigate some of that pressure coming down onto the perineum. And then also a lot of people use peri bottles. I think everyone should use one just because it's nice and it helps you be clean. If you have had a C-section even, so let's say you go through some of the laboring, you're pushing, and then you end up getting a C-section. You're like, I didn't tear. My first poop's going to be fine. And then you sit down and you're like, but I can't turn and reach my butt to wipe. Like, how am I going to be clean? Use your peri bottle. Like, have one anyways. Even if you are having a scheduled C-section, use a peri bottle because once you've had all those layers of your abdominal cavity cut open, it can be pretty sore to rotate, right? So reaching behind you to, wipe can be quite uncomfortable. So use a peri bottle, spray, have a cloth to just dab it dry, and it'll probably be better off. And then last thing for first poop postpartum is trying not to hover over the toilet. Really, we don't want anyone hovering over the toilet. It doesn't relax your muscles. It doesn't relax your pelvic floor muscles. If your glute muscles are on, if your quads or hip flexors are on, your pelvic floor might get the cue to stay on as well, and that could make it more challenging for anything to come out. So pee or poop. Okay, that is my big spiel about pushing and pooping. I'm going to go into some positional stuff. Does anyone have questions about the pushing and pooping stuff? I'm just checking the chat. Nothing?
Please, anything come up, her know. This is so good. I love it. Yeah,
It's
keep
okay
going.
if anyone doesn't have any questions. It's okay. Or you might be thinking it and you want to like email me later. That's very fine. Okay, let's get into it. So with birthing positions, the reason I'm bringing this into this is, orgasming will actually, so when you orgasm, you're having a very strong, pleasurable contraction of your pelvic floor. So it won't actually necessarily relax your pelvic floor. It's a very big contraction. If you have a very neutral pelvic floor at rest, after it could bring it back down to neutral. But if like it depends on what your state is. And I wouldn't necessarily say that it relaxes your pelvic floor. If anything, it's tightening things up. Because if like some people may have experienced this where like you have an orgasm and then it's harder for you to go pee after, right? Like you have to pee. It's not just the sensation. There genuinely is pee in your bladder. You got to go pee. You're sitting on the toilet, no pee's coming out. Pelvic floor has been tightened from that orgasm, so it's not letting the urine out. So not necessarily, but that's a really good question. Good question. Okay. So what I was saying is that birthing positions I think are relevant in this because the goal is we're trying to prevent as much trauma as possible to perineum, pelvic floor, etc. So your position matters. If you have an epidural, like I said, use the mobility that you have. If you have very limited mobility, preference would be laying on your side. If you're laying on your back and you have to lay on your back, lift up. There's a little bit more gravity at play than if you're further back, right? So try to be lifted up as much as possible, or lay on your side. When we think about opening up our pelvis, this isn't the best pelvis for me to demo this on because I don't have like legs to show you. I'm going to show you it on myself as well. Our upper pelvis here, To open that, we want external rotation in our hips. So external rotation happens when we do moves, stretches like this. We're in wide stance. We're externally rotating. I just saw that question. I'll answer it in a sec. Or you're in butterfly. So these are opening the upper pelvis. Okay. That is in earlier stages of labor. Once we move forward through labor, we're looking at babies coming down and it actually has to rotate. So what we need to do is we need to do unilateral movements. Uni means one side. Or unilateral means one side. So for example, I love this, and I think this is one Hannah does. I think she kind of demoed it, but using a block. Hopefully you guys can see this. Okay, using a block here. So I'm getting movement on one side, right? You can be moving through it. Can you guys hear me okay with my butt to the yeah?
Yeah, we can hear you. Yeah, you're good.
I'm like, yeah, just my butt's talking to you. Okay, so here, switching sides. So that's unilateral. You could be doing rotations like this to get movement into one side. You could be lunging here, right? Because then we're getting some internal and then external here. It depends on what stage we're in. Okay, this is another good time to bring the ball into the picture. Oh. So lunging into the ball. Here, you could be doing this block one again while holding onto the ball if you wanted. The ball is very comfortable. It's comforting. If you have it at home, it allows you, like I said, to practice all these moves before you get into the hospital and have no idea what you want to do to make you comfy. Going cat-cow here, having the ball closer, bringing your heels out. This is how we get lower pelvis opening, okay? So internal rotation, when your hip here is rotating in, that is going to open up your pelvis. So if you are using the ball, you bring your heels out, that is now opening it up. So you could, if you put your hands on your sit bones, you would feel here, it feels like it's opening up a bit. And that allows for the opening of your pelvic outlet to let baby out. Other good ones. Oh yeah, I'll show you the side lying one. If you're side lying, you might have the peanut ball here. And then what you can have your partner do is hold your leg into internal rotation. So you're not just in neutral or like this. Like if we're out here, that's great for our upper pelvis, but our lower pelvis is actually getting closer together, right? Our sit bones are getting closer together. So here, rotate your heel out, opens up. You could even have your knees closer together. That it's still going to open up your pelvis quite a bit more than if your feet or your knees are separated and your feet are close together. Did that make sense? I feel like I just have word vomit. Oh, here, I'll read these. Sorry.
That was really great. Honestly, like I feel like so many women who are about to push their babies out need to watch this talk with you because the pelvis, you guys, the poses she just showed you will increase the diameter of your pelvis by 30%.
Yeah.
It's incredible.
We want to think of things that open our sit bones for when we're giving birth, like when we're truly baby's about to come out, right? So again, here, if you can imagine, this is hard, but rotating in, that actually moves our bones. These bones aren't just like stuck there. These are joints, right? There's lots of joints in the pelvis, so they actually do move, and they can move unilaterally too. So it can move like when you're walking, it's gonna slow this guy doesn't move. It makes it seem like it's all static, but it's going to rotate like this, right? Opposite of each other. So there is movement in these joints. So we want to feed into those. I'm just reading the question. If you get an epidural and don't feel the maternal pushing urge, you mentioned during timing contractions, should we be pushing with the contractions? So once you are fully dilated, that would be because that would be like the second stage of labor. You want to wait until you see the contractions, yes. So the coaching um, coaching if you have an epidural or if you don't have an epidural, sometimes like the doctor in the room will immediately start getting you to start pushing as soon as you've hit 10 centimeters. It's like you've hit 10 centimeters, time to push. Great. If you have an epidural and you can't feel that urge, wait until the contraction actually shows it's coming. It may be a couple minutes, it may be longer than a couple minutes, right? It could be, I don't know, it could be like 20 minutes. Like it depends on the person. So watch what the contractions are doing. It may come immediately, and that would be when you want to push. Um, and then are there better moves to do during early versus active labor, or is it intuitively led person to person? So that's a great question. I would say earlier, you want to be doing, honestly, you want to practice everything. So during labor itself, it's going to be a little bit more structured, but leading into it, last 4 weeks of your pregnancy, even 5 to 6, you want to be trying all the movements out so that you're mobile, so that your joints are moving really well. And then during labor, when you first start going through labor, to open the upper outlet or the inlet, I guess, of the pelvis, this spot, that's when you want to be doing more external rotation movements. When you are getting closer to the second stage, you might start doing more unilateral movements. And then once you are in if you're fully dilated, you want to be in an internally rotated position. And leading into if you're like 8 centimeters, start doing some internal rotation sort of things to get the pelvis open so that you're opening as much as possible. Use the ball. You can be sitting on the ball. I didn't show this, but like doing hip circles, figure eights, tilt side to side, tail wags, whatever. Literally, I like the intuitively led comment, like whatever feels good, because sometimes you think you're going to do something exactly how your pelvic physio or how I said or how your doula said or however, and you just won't because you're like, that does not feel right. Just do whatever feels proper. That's a great question. So I was kind of saying yes and then or saying no, where you kind of want to do different things, but then also absolutely listen to your body and your intuition. Okay, and then I wanted to also touch, because I know timing wise, I don't want to take forever. I have a couple last things. Partners, I think it's really important for our partners to be active in the room. If you have a partner with you in the room or a family member, or whoever, anyone who's there for your support. So partners can be great for emotional support, for physical support, for example, like holding your leg up. I also think it's really beneficial for partners to advocate for maternal pushing. So if you know your partner knows you want to be pushing with your instincts and the doctor or whoever's in the room is coaching you and you're in this super vulnerable position where you're just giving in, sometimes it can be nice to have a cue with your partner to be like, okay, can you advocate for this for me? I can't do it right now myself, like I'm in too much pain or whatever, right? So having a partner knowing what you want out of birth is really, really important so that they can help advocate for you. And then your partners also help big time with poop shame. There should be no poop shame. And if your partners recognize that this is something that's normal and expected, then it will help you be more comfortable with pooping during birth. And then lastly is you can use a TENS machine for pain, and having your partner kind of have that on deck and like making sure that they know how to use it and how to set it up with you can be really beneficial. So you don't have to think as much. They just help you out. Yeah. And so with Hannah's class today, she's going to go through that intro to pelvic floor stuff, but I think it's really important for you guys to try to practice some louder breaths and exhales, and feel when you're exhaling, your pelvic floor is softening, even though generally your pelvic floor will pull up. So loud breaths to try to bear down and open up the pelvic floor versus like just directing breath out and up. Yeah, that's what I got for you guys today. I think there were some great questions, and I hope I didn't talk too long. I just felt like I was rushing there. I will give a little plug for myself. If you want to book with me in Kelowna, I'm at two clinics, Forest Wellness and Care Physio. And then I also do any physio in across BC virtually. So if you're in a more rural setting and you don't have a pelvic floor physio present, I do lots of virtual pelvic floor assessments and treatments. And I love virtual because it allows you to take it all into your own hands and you don't rely as much on someone else, which sometimes can become a trend in in-person physio. So opportunities to see me again in the future if you want.
I do have a question for you that's from Instagram.
Yep.
What's the most important thing clients can do prenatally to protect their pelvic floor post delivery?
That's a hard question. I would say honestly, things like yoga and staying active. Because in things like yoga or even just going to the gym or whatever intuitive movement you like, you are practicing lengthening and shortening the pelvic floor. So a big thing with pelvic floor is like I'll use my really jacked bicep as an example. Like if this is your pelvic floor, for an example, and it's always up here, that's not great. Okay. If this is your pelvic floor and it's always down here, it's always lengthened, not great. When you do yoga, when you do exercises, it's amazing that it can move through the ranges without all that much effort. And we do that when when we're in the gym with our arms. It happens to our biceps too. We don't think we just have to have it in a tight position. It's a very big misconception about tightening up our pelvic floor to prep for birth. And I think recognizing that, yes, having strength in our pelvic floor is going to be really valuable for postpartum, but also being able to have that relaxation. So being able to move through full range through yoga or through just a set of 10 exercises that you rely on, whatever it is, and having that mind body connection. I think that's the most valuable thing you can do. And also just not neglecting it, like recognizing that there is something that you can do to prep and you don't just wait till you give birth and then deal with the trauma after kind of thing. Like there's things you can do to get ready. um
Yeah, totally. 1 second before you get into that, I just wanted to show you guys. So exact, I love that you shared the mooing breath because in my course, that's one of the things the midwife said, and that's why I added it. So if you guys can see it here, I have 6 classes, six, that's it. That's all you need to do. And what Skylar was saying was that practicing, that's what these are. It's just, okay, I need to do a little exercise, practice. It's just practicing. And class 2 is actually, class 3, positioning a baby in the pelvis. They call it the house breath. So when you exhale, you say the word house, and that'll do the same thing. Push the same thing as the purple pushing without
yeah.
pushing like that. It's that relaxation or ha. So today, actually, in the yoga class, I'm going to add on ha breathing. I'd love the moo, but I think if people watch this after, they'll be like, "What are they mooing?"
Yeah, yeah, yeah.
Right? So we'll do ha, but it's the same thing. And that's why I have this course is so you can practice. So even if you're like 35 weeks or later, you can still do these like every second day and just be like, okay, I'm practicing what it feels like to connect to my breath and my body. And it's why I made it so that you could just go through like your favorite classes. This one in a class I do in labor, I am doing exactly what you were teaching with the birthing ball. Like I'm here on a birthing ball. I'm doing those figure eights and all it. I get on all fours and use the birthing ball too. Like they're super helpful to have. Like if you can see me here doing cat and cow, like moms have done this class on their apps, many in hospital. So I just wanted to say that. But here, I'm going to remove spotlight, go back to you, and go
Yeah.
ahead, answer the questions.
Yeah. So, when to start seeing a pelvic floor physio? Depends if you have problems or concerns with your birth at any time or a pregnancy, sorry, at any time you could go see a pelvic physio. Generally, if I'm seeing someone for birth prep and education, I'm going to start seeing them maybe like 12-ish weeks. And then if there's no concerns, then we'd follow up maybe around 24. And then usually I'll follow up with someone around 33, 34. If there are concerns throughout, then I might be treating pain or treating some tight muscles or whatever it might be throughout that time. But I would say, like, yeah, if you're not having any concerns, you could consider it around 12 weeks. Earlier if you want to, though. It's totally up to you. I've had people come and be like, I just found out I was pregnant. I'm pregnant. I'm 5 weeks pregnant. I'm like, okay, let's just talk about what that means for you now and like what's our game plan moving forward. And then, do you recommend doing the movements, exercises daily starting at 34 weeks to help prep with birth, or is it okay to start as early as now? Louise, let me go back. What week you are. You're due night or December 19th. I can't do math for that, but you could start to you could totally start doing it now. Um, Absolutely. Yeah, that's just like a 34, even earlier, like 32, you can start, but it could be, I'm just making sure I looked at the right person. Oh no, you're not December 19th. Sorry. I had a brain fart. Louise. 24 weeks. Yeah. You totally could start now. It's really up to you if it feels good. Perfect. If that's what the movement is that you keep doing so that you stay active during your pregnancy, I don't really care when you do it, how early you start, as long as you're doing it in general and moving your body. And it may be that that's the best way for you to move your body when you're pregnant. And yeah, I you can start as early as you want.
Yeah,
Good.
I was going to say that too. People ask me about prenatal yoga. When can they start? I say, as soon as you feel like you want to move. Like some people in first trimester just want to sit curled up in bed eating soda crackers. Other people feel great in their first trimester, and that's when they start doing like the birth prep yoga classes or like swimming or whatever else. It's really what your body feels like. You want to stay, it's everything in moderation. Like, don't
Yeah.
feel bad eating that big cinnamon bun you're craving. You're not going to eat it 3 times a day. It's like, yeah, you want to move, you want to listen to your body and see how it feels.
Yeah, I want to say one last thing because I know you guys got to start your yoga, but that being said, like movement during pregnancy doesn't have to be only yoga, though, right? Like you can maintain all those sorts of movements that you loved before, even some that are a little bit more vigorous, as long as you're given the okay. Running, uh, I've even seen people sprinting. That's a little crazy, but you could be doing running, you're hiking, strength training. I've seen people doing CrossFit, whatever you love, as long as you don't have complications or are high risk. We want you to stay active. And that's all I got for you guys.
Perfect. I'm going to stop the recording there.